How's it going, Modern Manual Therapy viewers? Dr. E here, and this is going to be a new series for social media. I just want to issue you guys the MMT, or Modern Manual Therapy Challenge. This week, the challenge will be to, if you're still doing joint mobilizations, which are a great technique to improve mobility, I want you to either only do distractions or do the opposite of what you would normally do. So if someone has a loss of shoulder IR, instead of just doing posterior glides like you would normally do, why don't you just try doing only inferior glides or only anterior glides? Because chances are, again, if you have been following along for a while, you would know that what we're really doing are not mechanical things. The inferior capsule isn't tight. The inferior capsule or anterior capsule isn't tight. We're not really deforming capsule or modifying it. If we could change tissues as fast with manual techniques, we would actually be rupturing them. Mobility tends to improve a lot faster than tissues adapt. Tissues have to adapt in order to change, and that is not happening. There are neurophysiologic changes. You're changing the perception of a stretch or perception of threat, and that's what increases mobility, motor control, and strength so rapidly with manual techniques. So if things were really working like we were taught they would, and it was taught 20 years ago to me, and it was still taught in even advanced fellowship programs today, that arthrokinematics matters for manual therapy. It does not. If it really mattered, you could do the wrong thing and the desired effect would not happen. When in reality, just by oscillating a joint in, say, inferior glide or posterior glide or a simple distraction, again, I'm not using the official handheld techniques, but you get the idea. Just by oscillating the joint, what you're really doing is you're stimulating the joint. You're firing mechanoreceptors that's bombarding the central nervous system with novel, proprioceptive, non-threatening information, and that's what kind of causes that CNS lockdown to reset, and the patient has decreased pain, increased movement thresholds. So that's my challenge. On patients, you know what? If it doesn't work, it doesn't work. But I'm willing to bet for the majority of you, if you do something that otherwise is not indicated, again, like an inferior glide for a lack of IR, an anterior glide for a lack of IR, it's still going to improve the IR, because whatever is missing with the right non-threatening novel stimulation, it's going to improve. All right, so that's my challenge, the MMT challenge for this week. Report back on Instagram or Facebook what you find, or leave a comment on the blog. Remember to subscribe to Modern Manual Therapy via Facebook, Instagram, and YouTube. Check out Edge Mobility System for our new Edge restriction cuffs, the classic Edge mobility tool, Edge suspension trainer, and more. And I hope to see you at an eclectic approach course soon. You have a great day.